Thank you all for coming to this all program. This is Ashley Rodriguez. She is a coworker of mine at Mid-Michigan Medical Center, Alpena. And she is going to tell us a little bit more about her background, but she's originally from Alcona County and recently moved back here just a few months. And she's going to be talking about how COVID-19 and mental health or behavioral health pandemics are coinciding and why and what she's doing about it. What we are doing about it.
Thank you for introducing me. First off, just if I could get, is anyone on Zoom able to signal somehow that they can hear us? I know there's, they can hear us? Okay, perfect. If I'm going too fast or you can't hear me, just signal us and we'll go from there. Also, I apologize because I have a tendency to walk off screen because I talk. Well, I move and I talk. So if I do that, just somebody flag them down and they'll tell me to get back in the frame. So just thank you for inviting me to come speak to you today. I'm going to go a little bit into I'm going to sort of tailor the presentation to what everyone is interested in. If this seems like it's being very basic and you'd like to go deeper, we can absolutely do that. If it seems like I'm going too deep and taking it too far, just hold on a second, wait a minute, I have a question, and back me up. We can totally do that too. That's anytime we're talking about issues like mental health, I want to make sure that we're slowing down and taking the time people need to be able to hear it. So, okay, we're going to start right here. So the basics. As you all are aware, I mean, this stuff shouldn't be a surprise to anyone. The COVID-19 pandemic really shut the world down. And it was something that, while it had a global effect, has disproportionately affected certain groups. And my part of this today is to talk to you about how it's affected mental health across those groups. So I'm not just going to be speaking from the perspective of my patients in Point East in the inpatient psychiatric unit. I'm going to be talking about multiple groups and how they are affected and how they're proceeding through this pandemic. We're going to talk a little bit about systemic issues and the way we got into this mess, the problems that the pandemic really highlighted, and I have to hit the admit button, there we go, and the gaps in services that we still need to address because we're not there yet. We're not through this and we're nowhere near done. I am going to go a little bit about me. I know she said a little bit of my background. This is my academic background for those of you who can see it. I'm originally from Alcona County. My mom's a teacher at Alcona High School. My dad ran Thunder Bay Title here in Alpena for a very long time. And so local girl, but I moved away to college in undergrad and then on from there. So to give you an idea where my perspective comes from and where I started with it though, in middle school, Alcona ran a program called Natural Helpers. Has anyone ever heard of that one? So the idea was they recognized that children and teenagers were not going to be reaching out to grownups for help. They just weren't going to. They're going to go to their peers. So they're like, let's identify the peers that are already going to get that call. Which friend is going to get that call when you're pregnant and don't know what to do, when you're suicidal, when your boyfriend is beating you? Which friends are getting that phone call? Let's train them in counseling so they at least have the right answers when their friends call them, because they're going to. And I was one of those that was identified. So my first classes in mental health and peer-to-peer counseling and motivational interviewing and substance abuse and crisis counseling and suicide prevention, I was 11 years old. And so I've been doing this literally my whole life. This is what I do. I work in mental health. I then went on to a psychology degree at Grand Valley State, and then forensic psychology from Argosy University. Now that is out in Washington, D.C. I've been on the East Coast for the last 15 years and studied forensic psychology, which is the intersection of mental health and the legal system. So competency to stand trial, guilty but mentally ill, not guilty by reason of insanity. Those are concepts that I would have been an expert witness to testify in a court hearing. I also worked for many years as law enforcement, as a parole and probation officer in DC, working with clients who had at least one mental illness and had been convicted of at least one crime. And I worked with them to supervise them and get them back on their feet and into services in the community. I've worked in substance abuse treatment. I obviously now work in inpatient psychiatric. I'm licensed in both Maryland and Michigan at the limited level. And I went back for a second master's in social work through Arizona State that I wrapped up as the pandemic hit in 2020. So where I come from on this, I'm bringing multiple perspectives, and I'm going to touch on each of those. That's the reason I'm telling you all this. I am both a psychologist and a social worker with the separate perspectives those things bring. I'm both a country girl and a city girl because I've been in DC for a long time. So when I talk about how it's disproportionately affected different populations, it's coming from past work experience and also data driven, because we're going to go into statistics. I'm going to try not to make it boring for you. I'm going to, try and make it interesting on what we're seeing. So that's me. All right. So sliding right into the statistics. So what we know, obviously we're still early. The pandemic is not done. What we have is data from last year and the ability to compare that data to years prior. So that's the data that I compiled and that I've put into my presentation. And a lot of it is from the CDC, the National Institutes of Health, and from independent research studies that have been conducted globally to try and compare trends across national boundaries. With me so far? Awesome. So one of the major studies that the CDC did was comparing data they collected in late June of 2020. So by this point, we're about 6 months into the pandemic, right? We're still getting started with figuring all this out. We didn't know even by that point whether or not it was transmitted through touch, how long it stayed on surfaces. We didn't know anything yet. So everyone was operating from the standpoint of crisis. And the data that they surveyed, that they were able to find, reported that 40.9, almost 41% of the people they surveyed reported struggling with mental health and substance abuse issues. They broke it down for us here about the kinds of symptoms that were reported, right? We have the majority reporting anxiety and depression. Makes perfect sense. I think everybody here can agree that there was a lot of anxiety when we didn't know what was going on, when the pandemic was getting to hit its full stride and we were all being told to stay home. Same thing with depression, with being isolated in your home. We also had a high report of traumatic stress disorders, of starting or increasing their substance use, and seriously committing suicide. Now, it should be noted about these facts that these are just the people who responded to the survey in the month of June 2020, and that they only surveyed adults over the age of 18. It was not at that point allowed for the CDC to survey minors. And so these numbers are low. These numbers are an underrepresentation of what happened because they couldn't even gather all of the data. Not everyone answered the phone. Not everyone was willing to do the survey. And they couldn't even check on a large portion of the population. Now, I want to pause here for a second and talk about those illnesses specifically, because I don't want to assume anyone has this background that I do in mental health and knows what these things mean. So when we talk about depression symptoms, to meet the criteria for a diagnosis of depression, it's more than just a depressed mood. We look at what's called functional impairment. We're looking at, are you able to function in different areas of your life? Are you able to get up and go to work? Are you able to shower yourself? Are you able to remember to eat and to go to sleep? So any of the symptoms that are part of the diagnostic criteria for depression were what were surveyed in these kind of questions. The same thing is true with anxiety. It's more than just feeling nervous. Anxiety symptoms range from your heart racing to panic attacks, even sweating, sleeplessness, rumination, where you're just running the same thoughts over and over in your head and you can't get it out of your head. I don't know about you, but I can definitely say that was me for the first 6 months of the pandemic, running the thoughts over and over my head. Is my family going to be safe? Am I safe? What are we going to do? How is this going to work? Trauma, and when we talk about stress disorder symptoms, now we're moving into conversations about hypervigilance, like being constantly aware of your surroundings and protecting yourself and always ready to be on your guard, that fight or flight instinct, which is actually fight, flight, and freeze, which a lot of people reported was that locked up panic of, I don't know what to do. And I can't seem to make any choice. I can't find a good decision or a right answer. So I just didn't do anything and basically collapsed in on myself. When we talk about trauma, the key factor is trauma happens when your coping skills fail you. When we don't have the ability to cope with what's going on. When you don't have the skills or the resources or the means. And sometimes that's internal skills, like resiliency in yourself and a flexible outlook on life and a strong sense of who you are and your ability to get through things. And sometimes that's resources on the outside, like the supports you would normally rely on to get through the day. So lots of reporting of traumatic stress. And then we move into, obviously, I don't think explain substance use. That one makes a lot of sense. People were home all the time. They didn't have to go to work anymore, and they had easy access sometimes. And it's a coping skill. Substance use is sometimes used to manage those other things. It's not a great one. There are lots of better ones, but it does happen. And then the seriously considered suicide, obviously, that's the people that got to the point where they didn't see another way out. So the basic overview of the mental health issues that I'm talking about. Now, there are plenty more. There's also a diagnosis that they can't really test for in this way because of the fact that the diagnostic criteria would just be, it would be massive, the sample. There's a diagnostic term called adjustment disorder. And what that means is you didn't have any symptoms until a stressor happened and you couldn't cope with it. And now you have all of these symptoms like depression and anxiety and trauma reactions that are tied to that event. And if those symptoms last less than 6 months, you meet the diagnostic criteria for adjustment disorder. And I'm going to say that last year, the vast majority of people would have met the criteria for adjustment disorder. So they can't screen for it because it would have definitely skewed the data. Screwed is kind of relevant too, but it would have adjusted the data in a way that would have made it not helpful. But that is a diagnostic rule out that they're aware of as well, that some of these reactions, if they passed in a 6 months period, were really meeting the criteria for adjustment disorder. Now, when we break that down even further, and they looked at what types of respondents endorse these things, that's where we start to see those disparities. 75% almost of young people under the age of 24 reported at least one negative symptom. Almost everyone, right? The majority of people, very few people came back and said, no, I'm totally fine, this is great. No. There was a slightly less percentage, but still significant, more than half reported it between the age of 25 and 44. More than half of the Hispanic population that responded, 66% of the people who had not graduated high school, the majority, 54% of our essential workers, and one of the largest numbers also, 66.6% of the unpaid caregivers for adults. Now, those are the people who have, say, elderly parents or grandparents that they're solely responsible for caring for, that during the pandemic now lost the ability to have a nurse come in, to have a case manager come in, to have backup support, to have anyone else take over so you can get out of the home for a period of time. That group was disproportionately affected across the board. In every survey, in every research study, the unpaid caregivers for vulnerable adults and for young children with disabilities were devastated. When we move into it even further, they break it down on all of these levels. So when we talk about simply comparative shots of a dichotomy, males versus females, men were more likely to report suicidal ideation, substance use, and those negative psychosocial symptoms. There's lots of possible reasons behind that. I obviously could speculate on a few, but I can definitively tell you because it's not how research works. But there was lots of discussion on, which group has better coping skills, which group has more supportive resources. As the female population is more prone to social network and have friend circles, does that affect why men are taught not to ask for help? Could that be what's going on? That they're feeling like they have less supports. Lots of ideas behind that, but not definitive data yet. Black and Hispanic were more likely to report than white and non-Hispanic or Asian. And that goes back to those racial disparities we're talking about. And we're going to circle back to that too, that communities that were hit harder, that had very few supports, they didn't have the resources to make the adjustments that the white and white and non-Hispanic Asian population had the resources and the means to adjust. Employed versus unemployed. Now, this one is counterintuitive, you'd think, because some people, you would think that if they were unemployed when the pandemic hit and they have no income, that they'd be really more stressed out than the employed. But it's actually the opposite, because the people who had jobs and they were afraid of losing them, and they may be essential workers that are required to come in, and that's the next one down there, essential versus non-essential, they are faced then with the decision of putting themselves at risk or risking their family, possibly. Like I, for example, would have been counted as an essential worker, and my childcare fell apart. all the daycares are closed. But essential workers can put their kids in. But that means now that the highest group of contact rate, right, those of us that had to go out into the world and be exposed to COVID are also forced to put our children out into the world to be exposed to COVID before we knew anything. So these are the populations that we're starting to see massive numbers. Now, like I said, we can compare 2020's data back to the year before to get a glimpse of how significant was this change? How significant is the increase in symptoms? When you compare the data just from 2019 to 2020 in the same relative months, the reports of anxiety was 3 times higher and the reports of depression was 4 times higher. That is massive in the mental health field. You never see increases like that. So it really highlighted just the overwhelming effect the pandemic had on globally on our mental health. Anybody got questions so far? Am I going too fast? Good? Great. Okay. We're also going to talk a little bit about abuse and violence. Now, these stats, I'm also going to say we have to take with a grain of salt. Now, you'll see at the top, they did elder abuse studies that show that during the pandemic, they went up 83.6%. I just balked at 44 on the last slide. So 83 is devastating. Again, it's that huge disparity in where we were before. Now, part of the reason for this is possibly that the caregiver is now under that immense amount of stress we were talking about, right? And that's leading to maladaptive coping. Domestic violence reports in that first month of the pandemic, right as the stay-away orders took effect, went up 10 to 20%. Again, you're trapped in your home with your abuser now. So those reports we saw climb immediately, and they stayed high. And they stayed high throughout the pandemic. And then one of the ones that I almost hated typing in here, NBC News, which I know not exactly an academic source, but they did a lot of research on this, did an analysis of reports on child abuse and neglect. And between April 19 and then comparing the data with April of 2020, it dropped 41% because the schools were closed and there's no one to report the abuse. The children don't have a way of seeking help for themselves. And the schools were closed. I promise it's not going to be all doom and gloom. If you're thinking this is going to be sad, we're going to move on to other things, but it's important to realize that these are underreported statistics. Victims are in their homes. The abuser is now always there. There's no opportunity to get out. And the effect that that stat alone has on community mental health and the mental health of our population as it grows now and moves on post-pandemic is going to be seen for decades to come. So we go into a little bit of the reasons. Now, backing up to that combination I have of psychological and social work perspective. We do an assessment with any client that comes into any mental health setting, and this is universal. I did it at mental health agencies, I've done it at law enforcement agencies, I've done it anywhere. The person in my job does what's called a biopsychosocial assessment. And it's looking for those functional things we were talking about on each different level. How are you functioning in terms of job? How are you functioning in terms of income? Do you have enough food to get by? Are you making it to work? How are your interpersonal relationships? Are you struggling with the people you connect with? What is going on? Housing instability. Do you have access to supportive resources? Do you have strong coping skills? What do you normally do to make yourself feel better? What can anyone else do to help you feel better if it's starting to go bad? Do you have any pre-existing mental health issues? And how were those treated in the past to bring you back to being okay? And what's going on in home with those role expectations now that the world has changed? So when we talk about an individual person and looking, away from the global for a minute on the factors that we're considering to see how your mental health may have been affected, as you can imagine, almost all of these were altered by the pandemic. Many people faced housing instability. Many people didn't know how they were going to get food. Again, I go back to the schools were closed. Do you know how many children in this country only eat if they go to school? Because school gives them food and their parents can't. And so we had a massive crisis on several basic human needs, which affected the mental health of all of those people as well. When we look to with the people with the pre-existing mental health issues, again, those symptoms, what you can see as a symptom of mental health issue were then altered by the pandemic. People, normally we would say that isolating yourself and withdrawing from society is a symptom of depression or anxiety. Those are two well-established symptoms. Well, now you're supposed to stay home and you're supposed to isolate yourself. So how is that going to be affected? If isolation causes you to have increased anxiety or increased depression, well, then this pandemic's the worst thing that's ever happened to you because you have to stay alone for the next 6 months, right? And then the role expectations. I didn't include the stats because I thought it was sort of, the stats are varied depending on which source you're pulling, but they were seeing trends as well that now that both partners in a home are home all the time, they needed to find a new way to define their roles within the house. So I'll use my family for an example. And if my husband is listening, I'm going to call you out. Two partners living in a home with children. Pre-pandemic, which one of us makes the meals? Which one of us deals with the children's homework? Which one of them does bath time? Who does bedtime? Who's responsible for cleaning the kitchen? And that was already before you even had the part where you're home all day. That's just, you made one meal, you made dinner together, but the rest of the meals you're out of the house. Now you're home all the time and you're getting on each other's nerves. Right? You're at this point on each other's nerves, in each other's faces, and those roles have to be redefined. When we talk about the choices that had to be made, most of the time in the pandemic, if there were two working partners and only one could keep their job because childcare closed and one of them had to leave and stay home with the children, it was usually the female partner that left the workforce and stayed home with the children. And part of that goes back to pre-existing roles. And part of that goes back to the fact that we are not paid on equal level with men. And therefore, if two partners and we can only keep one job, we're going to keep the higher paying. So it forced a whole section of the population into leaving the workforce. It forced a whole section of the population out of their probably desired role. I myself don't function well as a stay-at-home mom. I tried. I love you, my husband again. I tried. It's not the role I'm meant for. But during the pandemic, I did. I stayed home because his job pays more, because our childcare was closed. And I'm not anywhere near the only person who was forced into doing that. And then when we look back again at those other subgroups, we had the choice. I had the ability to decide if I was going to walk away from the workforce because of my income level, because of my social standing, because of my race, because I was not in a position where we couldn't survive on both incomes, that we needed both incomes to live. There were large populations of communities that didn't have that choice. So now they don't have childcare and they're still going to lose their job, or they have to face the choice of leaving the child alone while they try and keep their job in the middle of a global pandemic. I want to talk for a second about the social work perspective because I think I've hinted at it a lot along the way. And if you're not familiar with social work, this is a good example, this visual of Bronfenbrenner's ecological systems theory. Now, he wrote a book in 1979 called The Ecology of Human Development. And his theory, which at this point has been widely and globally accepted across not only social work, but other disciplines as well. The idea is that you can't change one part of a system without affecting all the others. So take a look at this picture. You've got your individual person, which I realize now is spelled wrong. I'm sorry about that. You've got their microsystem, their immediate family, their home, school, neighborhood, community. You've got moving further out, maybe your parents' work. So like take, for example, a child that goes to school and then you move out from there, your mom and dad's work, and then move out another level. You've got the media, the parents, the schools, the child's school, community services, and moving out to your culture and your national norms. A change on any one of these elements, on any one of these levels, affects the other. Now, normally, under a normal circumstance that's not a pandemic, we would be able to recover if one of these elements changes. You may have a little falter, you may have a little problem, but one of these elements changes, you can recover. Like take, for example, the case of divorce. Parents split, it affects the child, it affects how they do at school, it affects their behavior with their friends, it affects the parents and their behavior at work. The system shifts, you eventually find that balance again, that equilibrium, and you pull it back together. But what happens in a pandemic when multiple elements of your systems fail? or alter. It's almost unrecoverable. And that is what the mental health system has been, worked towards fixing, and why we can't just, work on mental health issues in terms of fixing one level. We can't just give everyone counseling and it'll be fine. It's not going to work. We have to do more than that. We have to adjust and make efforts on every level. And that's community building. That's resource development. That's community education like this, coming out and teaching people about mental health issues. Because if you're not aware that these things are happening, how can you make an impact to fix them? Right? So targeted change on multiple levels to try and bring things back into balance for people. So now we're going to move into what the good part is. The parts that we have done to try and improve, to recover, to put in efforts for individuals, groups, and communities. So that starts with you saw immediately the individual crisis response. They opened food banks. They put in eviction prevention requirements that you couldn't be evicted in the middle of a pandemic because you lost your job due to COVID. A massive array of counselors. Has anybody ever heard of the FEMA traumatologists? Is that a thing? Anybody? So FEMA, right? The disaster people, the people who go out when there's hurricanes and there's earthquakes, they have a team of mental health professionals. No one ever sees them because they come in after. They come in after the food resources, after you bring water to the Superdome in Katrina, after you get people into shelter. The counselors show up because they realize those stress reactions, that trauma is coming. Right now you're in crisis. Right now you can't handle anything. So we're going to work on those basic needs of food, shelter, safety. But as soon as that passes, that's when the trauma is going to hit. And so the counselors show up. So we had the massive crisis response, which I personally found to be just overwhelmingly impressive, because globally we did this. We sent counselors to other countries sent counselors here. We responded en masse as a populace, as a global populace, to say, we need to help as many people as we can right now. Now, obviously, it was made difficult by the fact that we weren't supposed to be traveling to, decrease the risk of the pandemic and spreading the illness. So we had to find other ways of doing it. That's where we get into things like expanded telehealth services, prioritizing childcare to make sure that we're keeping as many children safe as possible, but supporting the children whose parents are absolutely needed out in the world. The parents of the medical professionals, the ER staff, the ICU staff, getting them to work and making sure their children are cared for in a safe and cohesive way. I want to go back for a second to telehealth services. One of the other major changes the mental health system did to adapt to this was to broaden not only how many places could offer telehealth services by increasing the technology, but they also made adjustments to our structures and allowed clinicians at lower level licenses who would normally not be allowed to do telehealth without being fully licensed to provide those services, because there just simply weren't enough of us. Normally, I would have to be fully licensed at the end of another year and a half to give, you know what, there's my husband admitting into the room. I would need to be fully licensed to provide these kinds of services. But during the pandemic, they recognized some mental health background is better than no mental health background. Let's at least let them help beginning to support people and offer the staff supervision to back that up. They allowed flexibility in workplace structures, right? How many places adapted and said, all right, we're going to do, remote work. We're going to allow some flexibility in your hours because we understand your child is sitting next to you while you're trying to do this. They increased their options. Now, I'm going to circle back to these because, as you know, I'm going to point to this word privilege down here at the bottom of the screen. We're going there next. So any of you that are thinking, wait a minute, not everybody could do that, we're going there next. We offered additional supports in schools as classes are resuming, as schools are starting to go back. Now, that's another place where they changed our laws. Social workers used to have to be fully licensed to function in the school setting, to provide services to children. Until recently, actually last month, Alpena Public Schools reframed it and allowed a lower licensed clinician to be able to take that job because they weren't getting any higher licensed clinicians to take the job. And having a lower level clinician like myself be able to go into the schools and provide some amount of services with supervision is better than having that job vacant as our children are returning to school. And then I put my little thing out there, vaccines, right? The vaccine response, again, massive, global, still being worked out, still not perfect, but it's sort of that same principle of some help is better than no help. right? I personally was vaccinated when I started working in the hospital because it's better to have some kind of support going into a building where many people may be infected than no support at all. And the vaccines don't stop you from getting COVID, they just stop it from being as serious for you. So yeah, you may still get COVID if you're vaccinated, but hopefully not in a lethal way, not in a permanently devastating kind of way. So the vaccine rollout was one of the biggest adaptations. Never before in human history have we had the entire world's medical community united on one project. The polio vaccine took 5 years to develop. I'm not sure when exactly those years were, but some of you may remember it because I know it wasn't that long ago. Polio vaccine took 5 years to develop. We pulled off COVID in 1. And that is because we threw the entire world's medical community at it with a nearly unlimited amount of money. Fix this because we need to get back to our lives. So imagine what we could do if we were able to unite as a society and do that on any other topic. If you threw that kind of money and an unlimited amount of researchers at any other medical condition or mental health condition, imagine what we could do. That was one of the points that I know is unlikely to move forward for many reasons, politics and many other things, but we've now proved that we can do it. So let's do it again. That's where I go with that. When we look at individual changes, right, for person to person, we're working on building resiliency, practicing skills that will help you to cope. Resiliency is built best by trying new things. So I already love the idea of this group today because you try new things, even if it's not something you're used to, even if you try it once and go, nope, don't like that. The fact that you tried it helps you build that coping skill to adapt when things change. Seeking the professional support, that is another one that a lot of people pre-pandemic would not have considered therapy. They would not have considered counseling. They may not have even considered psychiatric medication, but they're seeing now where they've reached that crisis point where they can't recover on their own. Their normal coping skills aren't working. Let's seek some help. And then restructuring your life priorities. Like how many people right now are having the conversation in their homes of saying, I don't want to go back to work in an office. I've been working from home and it's working just fine for me and I get more time with my family. How many people lost someone during COVID and are now not willing to take for granted the time they had with others? I mentioned that we came home. I used to be in DC. We moved home during the pandemic. I say we accidentally moved home during the pandemic. We were in Baltimore, Maryland. I have 2 young children, 6 and 3, and my husband. We were immediately in the position where we all had to stay home. Now, I don't know if any of you have ever been to Baltimore, but Baltimore townhouses have a city street on the front and they back onto an alley and there's no yard, there's no grass, there's no outside space. And now the parks are closed. There's literally nowhere you can go, not even walking down the sidewalk, but you can be 6 feet away from everyone. So you're trapped in your house. We were the 4 of us trapped in our townhouse without the ability to go anywhere. So we made the decision because we had the resources and ability to do it with working from home to quarantine and then come here to visit my family. Now, my children got about 2 weeks of playing in the sunshine and the grass at my dad's hunting camp and playing on the beaches of Lake Huron. And they said, you can go back to Baltimore if you want to, but we live here now. We're going to stay with grandma. We're not going anywhere. So my husband and I were like, we don't have to go back. Our jobs aren't open yet. Let's stay for a while. And that 2-week vacation turned into 2 years and I live here now. So it's kind of a fun. My mother, of course, is loving this because the grandchildren are now not in the city where it's safer here and here with her. But that brings me to the next point, which is I had the privilege to do that. I had the means, I had the money, I had the family support, I had a place to go outside the city. Not everyone had that. We've had centuries of systemic racism that has left large groups of people without those resources. If you look at just basic things that some groups take for granted, like when you have to get a cosigner for a loan, well, that means that someone else needs to have the financial stability to be able to sign that document and have account for the bank. Not everyone has that. And not everyone has that because there's been years of groups not being allowed to go to schools, groups receiving inadequate financial support, generations of families that are still trying to build from when they had nothing. You know, my great-grandparents were probably lower middle class during the Depression, but they were lower middle class. My African-American counterparts, their grandparents were slaves during that time period, had literally nothing to pass down to their children. Every generation is trying to improve, but if you're coming from nothing, then you have nothing to fall back on. And that's the point that I'm trying to make here, is that what if your job wouldn't let you work from home? What if you didn't have a home? What if you were already homeless before the pandemic started? Baltimore, Maryland has 80% of the state of Maryland's homeless population living within its city limits. One city. 80% of the state's homeless population lives in downtown Baltimore on the street, because we don't have the shelters to manage them. So if you were already homeless and now you're being told to stay home, if you're already homeless and you're going to be arrested for being out after curfew, but you have nowhere to go, what are you going to do? If you can't afford childcare, or you can't risk exposing your elder grandparents or family members to ask them to be the childcare so you can go to work, well, now you can't work. But we talked before about the abuse and the people in violent situations. What if you can't seek help when you need it? What if you can't see any options? And that's where the mental health crisis collapsed. A large portion of our population, and a disproportionately minority population. Now, these changes that we're working on, these improvements are wonderful, and I'm not discounting them. I don't want to make anyone think that, well, we're not doing enough. We have more work to do, is the way that I say it. We've done wonderful things, but there's still plenty of people out there without adequate childcare. The eviction preventions are about to go away, and now you're 9 to 10 months late on paying your rent. And that landlord needs money too, because he's also got no food on his table if he doesn't get paid either. What are we going to do? How are we going to build this back up? And those are things that are still being worked out. Now, the mental health field is working on advocacy and information sharing and modeling off of other countries that are, frankly, doing it better. There are plenty of countries out there that are doing it better with globalized mental health care and things like that. So that's where we're going with this. You know, the world is got to get back on track, but we have got to adapt as well. As we can see, if we just go back to the way everything was before, then we are not prepared if this happens again. And statistically, it will happen again. It's already happening again. Delta variant is bringing it back around. We're circling around to another round of people who need to stay home and be cautious because they're not vaccinated yet, or because their vaccine that they've had is not, you know, they've had one dose but not the second. We have people right now quarantining at home to avoid being exposed to the next round of COVID. And it's not the only illness out there. So we need to adjust and take what we've learned to adapt the process. And my big takeaway, if you haven't learned anything else while I've been speaking, is that accessible, low-cost mental health and medical care are basic human rights, and everyone needs to have access to them. We need to reshape our government policies, our local policies, our community mental health systems. I say that as someone who works right down the road at the hospital. We need to adapt our services to minimize the barriers for people getting help, because these are services that are not optional. We cannot function as a society unless we can right the ship on this and avoid going that way again. And that's going to mean an extensive overhaul of our mental health system. We're working on it. There's plenty of advocacy out there. There are bills before Congress now to improve those services, to expand those services. I can't speak coherently on Medicaid and Medicare because I'm frankly, that's way out of my depth. But the insurance lobbies are looking at what they offer and what they're willing to cover and what they won't cover right now, and how to make changes to that to limit the people that are falling through the cracks. So we will continue to do that. We will continue to do this, presenting to the community to educate them on mental health issues and try to move forward in a way that keeps us safe and healthy, but avoids us getting back into this mess all over again. So that's my presentation. I have a little bit of the references. I can actually send people, this isn't a very coherent one. I will highlight Ron von Brenner. It's a great book. He actually published several books, but his theory on human development is fantastic. And I would definitely recommend anybody interested in the social work perspective and that systems theory to check it out because it's fantastic. It's really the basis for all social work practice. So that is what I had. Did anyone have questions, or did I not go deep enough on certain topics you wanted to hear more on? Have concerns or disagree with me? I'm okay with people disagreeing too. I'm really good at that. I really am. Thank you. I tried. So I was trying to hit it from multiple levels because we don't exist in a vacuum. I don't know if anyone on the internet side of things had questions. I can't. Oh, yeah. That's my husband. I'm going to point at him. Anyway, so thank you for letting me come talk today. I appreciate it. Thank you. Stop the screen share there. If anyone has any questions, I'm happy to stay. And oh, I see a chat. What is a chat? Oh, that's from earlier. Okay. Front and runner. Yeah. Exactly. Yes. Bronfman runners. I was trying to get back to the chart there. That whole, yeah, it's, you can't change one thing without changing everything. And if you have one area that's affected, one hit to the system, you can absorb that. Maybe two, maybe three. If you're a really resilient person, maybe on more levels. But when the larger cultural system fails and your parents' workplace closes and school closes and the media is terrifying, right? The media in the early pandemic was, we don't know what's going on. We don't know how to fix it. Stay home. That's not helpful. Just the different levels of the person's individual functioning that started to get hit after hit after hit. And there's only so many blows you can absorb. And that's where we need the massive response of mental health systems to make up for it. Now, I should end with this. I should say, I forgot to add it. I didn't think to add this as a slide, but I should end with this. If you yourself are feeling any of these symptoms and seeking services, there is community support there. Like I said, right now we're still working out all the kinks, but the expansion of telehealth, the services that are offered here in the community, absolutely anyone, regardless of your insurance, can walk into community mental health and get a crisis appointment and see someone, and they will help connect you to other resources. And community mental health exists in every county in Michigan. It's not just you alone or out there in the world. Our local community mental health covers Alcona County, Alpena County, Montmorency, and Presqu'île. If you live in any of those areas, that's our local CMH. If you are not in those zones, call me. They will give you my number at the hospital, and I will find the one that covers your area. Because they're there and they have crisis and they have backup. They even have a juvenile crisis mobile team that will come out to you if you know of a young person that needs help. The resources are there. Sure. Sure. Compared to other statistical areas. Oh, sure. So she was asking about the local Alpena area and how we compare to other areas such as different counties or different parts of this state or different states altogether. So we experienced throughout the pandemic substantially lower rates of COVID. So we'll start with that, the happy thought, right? Of it was statistically safer to be here. It was statistically safer to be in most rural communities than in any of the major cities. So right there, we're winning on that. As far as though the response on the mental health side, there was still the same levels. We were still experiencing the same levels of the anxiety, the depression, the trauma, and the domestic violence, the suicidality. And part of the reason for that, honestly, one of the speculated reasons, and again, we can say this with a certain degree of confidence, but obviously not entirely certain that this is the whole reason. The northern Michigan area, specifically Alpena and Alcona counties, have a statistically higher average age. Right? We had a lot of seniors. We have a much higher, Alcona County is I think it's the 6th highest national age average in the country for a retirement community. And because of that, that was the population that initially in the pandemic was being told was at greatest risk. So those anxiety reactions were definitely all still there, regardless of whether you're in a high density population, because we have a higher concentration of the people at higher risk. Senior citizens, people with pre-existing medical conditions, things like that. We also have a higher than average, compared to the cities, we have a higher than average amount of blue collar workers who are more likely to have the associated medical conditions, like having lived a tough life and their bodies are not in pristine shape, and having been through things like I think we have a statistically higher average of smokers. We have a statistically higher average of cancer up here. And those pre-existing medical conditions also put you at a higher risk for COVID. And therefore, knowing that, they expressed higher concerns about safety and depression and anxiety. So for that. Now, as far as nationally comparative to different states, I can only give you the ones I worked in during the pandemic. So like compared to the East Coast, the Mid-Atlantic, the concerns were similar. Again, that anxiety, the mental health reports were consistently at high degrees, right? The same statistical rates of this many percentage of stress reports, this many percentage of depression symptoms, but the rationales were different, right? In the city, it's more about population density concerns. How many people are before me in line for the vaccine? It's also, like we said, housing instability. Alpena does have a homeless population. We have a couple of shelters. We also have a fair number of people who sleep on the street. It's not as readily obvious because of the numbers difference in a town this small versus a larger city. But in the city, that's where a lot of the concern came from too, was the rates of people with the medical conditions and the other lifestyle factors that led to their anxiety and depression symptoms. I will also say nationally, comparing our numbers in America to other countries, there were some we did really well on, and there were some where we were abysmal. For example, any of the countries in the world, mostly Northern Europe, that had nationalized healthcare systems did a much better job of rolling out things like the vaccine and of getting their medical attention to the right population at the right time, to the people who expressed symptoms. America did not do that, partially because of the issues with our own healthcare system. I keep saying symptom. I use the word symptom a lot more than system. The issues of access to services, right? Now, up here, like I said, primarily we have a lot of people with Medicare and Medicaid, but you also have a lot of people who don't have those things or whose private health insurance won't cover certain services. The insurance lobbies had to make adjustments in terms of whether they were going to cover telehealth, whether that was even going to be allowed. And if you were in the population of people whose insurance wouldn't cover that, you now don't have access to healthcare services. So depending on where you're from, it affected it. Now, you did see a mass exodus from the cities to people coming to the country, which is also why up here our housing prices exploded. Has anyone looked at the housing prices in the last year? My husband and I tried to buy a house when we moved here. Didn't happen. They want like 3 times what the house is worth. We're not doing it. We're not doing it because that's just insanity. And eventually this bubble will pass, right? And things are going to go back to normal. But the point of that being, city people realized all of the great things about the city are closed. Park is closed, the aquarium's closed, school's closed, my job's closed. I can't even leave my kitchen because there's nowhere else to go. And I live in a house the size of this room because it's Baltimore. And so there was a mass exodus from the city for the people who had resources. And again, it's back to that privilege. The people who had the means to leave have started trying to leave. And that's going to breed the expansion of telework and jobs allowing that kind of distance education and distance high school. And then there's all sorts of conversations on that as well, because we all know that part of childhood and growing up is learning to socialize and be part of a society. And how can you do that when you don't go near your friends, when you don't get to be with friends? There are really, really sad statistics about the minor population through the pandemic. A lot of it anecdotal at this point, because again, there's the issue of, like I mentioned at the beginning, gathering data for minors is difficult because you need the permission of parents. So we're still collecting that in a way. You have to hit a certain number of cases where you have data on to count it as a statistically relevant result. And without being able to interview that many children, it affects whether you can gather that amount of data. But anecdotally, there was consistent reports across the board of children attempting suicide because they just lost their senior year. They just lost their scholarships. They lost the ability to play with their friends and just play with sports. Young children, lower elementary school children reporting suicidality because they were pulled out of their world. And if you think about it, like as an adult, when the world closed last March, you had the ability to say, man, this sucks, but I get it. I need to stay safe. I'm going to stay home. You had the rational ability to understand that concept. But the children, right? My 3-year-old got pulled out of school, taken from his friends, and never went back and has no idea why. So that's where that education piece comes in, talking to the young people and explaining it and helping them to understand why these changes were necessary. The great thing is those same young children are also some of the most resilient human beings on the planet. Young children have that neural flexibility to adapt and learn new things and make changes in a way that some of us that are set in our ways don't, right? Some of our older population, your brain actually, unless you practice it, your brain stops giving you that flexibility. So while they're equally devastated by what's going on, they do have more of the resiliency if it's nurtured. Yeah. Yes. Yes. He asked if there was a large jump in the suicide rate during the pandemic. And yes, at least in terms of suicide attempt, we can statistically confirm that. Yes. Like, for example, one of the first research slides I pulled up, let me go back out to it, that had, when they did the surveys, at least 11% in June of last year seriously considered suicide. And it comes back to, again, that concept of the number of people who now had no options, no resources, no way out, and couldn't see any other choice. I can't tell you for sure about the rates of completed suicide, but the reports of thoughts of suicide, we have statistical data on.
Yeah. That data.
Good.
We have like 3-year-old data.
Yeah. We're working on it. Yeah. There's the issue of data because you want to make sure the data is valid, but we need to collect a substantial amount of it before we'll know. You had another question. Okay, well, she asked about the violence that we're seeing of people killing each other and that kind of reaction, and whether it's related to COVID. And my answer is going to be yes and no. Is it amplified by the stress of the pandemic? I would say yes, because again, this highlighted substantial disparities in our population that are coming to a crisis point, right? Before where it might have been a nonviolent protest or conversation, both sides are now under an immense amount of stress and fighting, literally fighting, to get out of the situation in whatever means they can. So in some ways, yes, that's connected, but I wouldn't say it's caused by the pandemic. I would say that those issues are highlighted by the pandemic because they were there before. You know, it's those issues, the killing is not new. It's just also, when you think about it, it's also more widely publicized. You know, we live in a 24-hour media cycle now. There's actually a great book. Oh, I'm gonna have to think of the name of it. I'm gonna think about it. My husband should go find it on the bookshelf. It's the orange one in the bedroom. Anyway, it's a book that I read in grad school about the resiliency of America, and not just America, but the resiliency of the human spirit. And it talks about the 5 great disasters and the communities and the way they recovered after. So it starts with, let's see, there was the San Francisco fire of 1901, right? When most of San Francisco burned to the ground, and how the communities pulled together to like drag kitchens out of burning buildings, drag wood stoves out of burning buildings and start cooking food for people on the street because the whole community is homeless now. Things like that. So it's the San Francisco fire. There was the Halifax explosion. That's when has anyone heard of that? The Halifax explosion. So I hadn't either, which is one of the reasons I love this book. Prior to the invention of the atomic bomb, so pre-1940s, The Halifax explosion was the largest explosion to ever happen on the face of the earth. And what it was a munition ship in Halifax Harbor, loaded down with ammunition, collided with another ship. And the blast was so large that if you were within a mile radius of the ship explosion, it didn't matter if you were inside, it didn't matter if you had your eyes closed, the blast was bright enough to blind you permanently. Yes, largest explosion to ever happen prior to the invention of the atomic bomb, and how that community recovered and banded together to provide services to help dig out survivors to move forward. So yeah, San Francisco, Halifax, and then there was the Mexico earthquake of 1985 when the building collapsed, and it was very much like what we heard recently in Miami, where it was a subpar building code from a shady builder. That resulted in massive casualties when this earthquake hit and the building collapsed, how that community recovered. And then it moves into 9/11. And there's one more, which I'm gonna have to think of what the last one was, because it was 5. I will think of, and the last one might've been Pearl Harbor. I wanna say the other one was Pearl Harbor, just devastating national tragedy. But it talks about that resiliency and the different communities and how they hold it together. And we have that ability, and we can absolutely do that. But even in those stories, there's conversations about the violence that occurred, the people fighting over resources, people who normally under other circumstances would not have resorted to violence that are now out here physically fighting someone over food because they don't know that there's going to be any more. And that's what we saw some of in the pandemic as well. People literally fighting to survive and to gather those resources. And when you think about it from that angle, if you can see the reason behind an activity, a behavior, you can approach it with much less hate and fear, right? You know, if you can see why they're responding this way, then you're like, okay, well, it's kind of understandable, right? They're just trying to survive like the rest of us, and they have less means to do it. So they're resorting to the means they have. And that's where, again, part of what's going to fix this from a social work perspective is going to be addressing those systemic issues, addressing everything from availability and cost of childcare and medical care and mental health care to whether or not genders are paid equally and have access to the same resources, so that if we got to a situation like this again, it's not a given that every female partner in the spouse relationship has to stay home with the kids because that's the way it's been done since the 1930s or whatever. We have to adjust on many levels: national policy, community policy, medical and health, mental health, and and just in our own local community. What was done here? I wasn't here for the early stage of the pandemic, but my family was. And I know that at least the schools got on board with the, let's provide food, because there's lots of community people who can't afford food. So food banks and vaccine drives and community kitchens and offering additional telehealth services and opening up who can go to different clinics and who can receive treatment at community mental health to try and to respond in the way that we can. I love the question. Anybody have any more questions? Is anyone else looking at the video thing to see if there's any over there? But I don't see any. So anyway, it's gonna drive me nuts until I remember the name of that book. Well, I might Google it. I'll be honest, there's a small part of me. It's like, I'm gonna stop sharing my screen for a second and just hit Google. So 1 second, because I really feel like it's a fantastic resource. Let me see. Exactly. And it's really wonderful if you look at it from that perspective. Was it, oh, I'm going to forget my quotes here, but there was I want to say it was Mr. Rogers that when he was little, saw something awful on TV, one of the devastating effects, and said, you know, look for the helpers, right? Somebody's always helping. You're looking at something that's awful and devastating and traumatic, but look for the helpers. I also think, let me close that out. The, like going back to what we were saying with that book and the how, like the different 5 major tragedies I mentioned, think about the ones that you didn't know about. That's because there was not global news. There wasn't, like, we were still delivering news on horseback when Halifax happened, probably. I don't even know. But, you know, those kind of global events that we only know through written history, we have no conscious knowledge of, right? Things like school shootings that happen now, they happened before too. They happen more now, but more important than that, we're aware of them because we see them on TV all the time. And I'm gonna also point out that there is no correlation, I'm gonna say it to the camera as well, there is no statistical correlation between gun violence and mental health. In fact, quite the opposite. Most people who are mentally ill are not violent. Violence is very poorly statistically correlated with mental health. You know what it is highly correlated with? Being a white male. Statistically, if you look at shooters, just gun violence, overwhelmingly, mass shootings are committed by white men. Like 80, 90%, like way up there. And while we talk about, oh, what was wrong with this person who committed this gun violent act, it's almost never a true mental health issue. That person doesn't have a mental health issue. They're mad, they're not mentally ill. Yes. Mental health people are often the victims, yes. So when you see them reporting on gun violence, I mean, like, oh, he had this, you know, his mental illness gun. No, it's not. No, it's not. He wasn't mentally ill. He was angry and made bad choices. And I say he with pretty good degree of confidence because, again, statistically, overwhelmingly, mass shootings are committed by white men. And that's the only factors that are correlated, that you can say with evidence, statistical evidence are true, is that their factors were commonalities where they were white men. Which is sad. Which brings back to, again, we need to teach our youth better coping skills, which is where mental health comes in as well. Yeah. Mm-hmm. Yes. Like I was saying, as far as increasing mental health services for the kids as they return to school, yes, they are going to be, like I said, they are allowing lower level clinicians to take those positions now because there are more of me at the limited license level than there are of the fully licensed because it requires extra years of practice and schooling and supervision. So opening up those positions to other levels of licenses allows more of those jobs to be filled because where Alpena specifically and the surrounding communities have struggled is just getting anyone to take the job. It's not that the job has not been posted. It's that we have a problem drawing young people and families to our community because of lack of resources. There's not even housing, you know, like how are you going to get someone to come here if their spouse can't find a job? So they are opening those positions up to a wider array of mental health professionals, which is going to hopefully translate to filling more of those jobs and providing those services. The school systems also have in them clinics with medical professionals, and we're trying to cross-train those professionals to make sure that if nothing else, does the school nurse have the resources for suicide prevention? Does the school nurse know the signs and symptoms of abuse that they need to be reporting as school returns? Do they have the access to connect us with other professionals? And so just like I mentioned early on about training those that are going to get the call for help, even if we wouldn't have normally been the one you'd want them to go to, if everyone was better educated on mental health and mental health resources, then we could all respond better in those situations. So cross-training the teachers, cross-training the paraprofessionals, the school aides, cross-training the nurses. And schools, yes, too. And also the telehealth expansion will allow for things like one thing that the local community doesn't have is a juvenile psychiatric facility. We don't have a juvenile psychiatric unit. We don't have a juvenile psychiatrist in the hospital that I'm aware of. Even the inpatient adult unit contracts out our psychiatrist. Our psychiatrist lives in Wisconsin. He's from here, he's from Michigan, but he lives in Wisconsin and he sees our patients via telehealth. Those are a way of adding additional supports for the people who are struggling, but ideally, we will work to incorporate more in-person professionals as we move on. And then we also have to think about those other logistics, like if you're home and you don't have internet, then you can't call in for a telehealth appointment. If you don't have access to, like how many children when the schools shut down couldn't participate in virtual school? Because they don't have a tablet, they don't have a laptop, they don't have a cell phone, they don't have a parent that can manage it with them if their parents have to be working. And it goes back to that privilege again of what communities have resources and what communities don't. So we're working on it. Anything else anybody had? I appreciate you guys coming.
Thank you.
Thank you.